am Dr. Esha R Shanbhag, Gynaecological Oncologist at the Aster International Institute of Oncology, Whitefield, Bangalore. See, cervical cancer is a very common cancer affecting Indian women. One woman every 8 minutes dies of cervical cancer. And nearly almost all of these cases are basically because of persistent infection with human papillomavirus. Most of these infections tend to get resolved over time, but if it is persistent, it can cause changes in the cervix and that can hence go on to produce cervical cancer. Can I do anything to prevent cervical cancer from happening? Yes, you're right. There is a vaccine called the HPV vaccine where you can prevent the cervical cancer from happening. See, this HPV vaccine has been there from nearly about 15 years, but there are a lot of myths linked to it. Today, let's discuss about these myths, get it clear. So the 5 most common myths linked to the HPV vaccines are: 1. HPV is very uncommon. No, that's absolutely wrong. HPV is a very common infection affecting both men and women in their reproductive age group. Nearly everyone once in their life are going to get infected with this. Second, HPV only causes cervical cancer in women. Yes, HPV does cause cervical cancer, but apart from that, it's also known to cause cancers of vagina, of vulva, of the oropharynx, that is of the mouth and the throat, and the penile cancers in the men. So it's very important that all the girls and boys have to get vaccinated with HPV. Third is the most common myth is only those women who are sexually active need to get vaccine. No, that's not true. Actually, the vaccine tends to be more effective if the girls are vaccinated before they have the sexual contact. That is, before their sexual intercourse, it's better to get vaccinated, and that is found to be highly effective. So the recommendation is either we give the Cervarix vaccine or the Gardasil vaccine to girls between 9 to 14 years. And according to the recommendation is giving 2 doses 6 months apart for girls and boys between 9 to 14 years, and if beyond 14 years up till 26 years, 3 doses are recommended. But doesn't mean that women who have already had sexual intercourse not to have vaccine. Yes, they can have, but the efficacy drops down to about 40%. So the fourth myth is, does HPV vaccine prevent only warts, or is it really very effective? Yes, HPV vaccine is effective in preventing warts. There are certain HPV types like 6 or 11 against which the vaccine works and helps in preventing warts. But the most important reason why the vaccine is given is to prevent the cervical cancer caused by the high-risk types, mainly the 16 and the 18 and the other high-risk types. So HPV vaccine is to be given mainly to prevent cervical cancer. And coming to the safety, it's a very safe vaccine. There are a few minor side effects like the pain or the allergy at the site of the injection, or you can have a low-grade fever, which is just like with any other vaccine. So the fifth common myth is, do we have to do screening even if vaccinated, or there is no need of it? No. Normally the HPV vaccine we are giving is against certain high-risk types. So it prevents cervical cancer against only those high-risk types. But there is a very rare chance that you can develop cervical cancer by other high-risk strains. So even if vaccinated, all the women have to get screened for cervical cancer. So to conclude, please vaccinate all the young boys and girls with HPV vaccine. Prevention is better than cure. So for any queries, please come back to us at Aster Whitefield Hospital. Thank you.